A new COVID-19 variant is spreading in Bali. A new COVID-19 variant is spreading in Bali, according to the Minister of Health. On Friday, June 10, 2022, the Indonesian Ministry of Health held a news conference to confirm the detection of 4 instances of Omicron BA.4 and BA.5 in Bali for the first time. Currently, variations under observation, those are actively spreading, include Omicron BA.4 and BA.5, Health Minister Budi Gunadi Sadikin told local media. In Europe, America, and Asia, this variation has resulted in an upsurge in cases. It has now been discovered in Bali, where 4 people have been infected. Omicron BA.4 and BA.5 are COVID-19 virus subvariants that are distinguished by their capacity to circumvent vaccine-induced immunity. They are extremely transmissible as a result of this. Stealth Omicron is the popular name for subvariant BA.2.12.1, which is the most relevant variant in the globe at the time, according to the U.S. Centers for Disease Control and Prevention, CDC. The newly discovered subvariants Omicron BA.4 and BA.5 now account for 7% of all known COVID-19 cases across the world. For the first time, Health Minister Sadikin was able to certify that Omicron BA.4 and BA.5 instances were tested for in Bali in late May 2022. Indonesia's Ministry of Health obtained confirmation of the positive blood test genome sequencing on June 9, 2022. The minister went on to say that the current increase in instances in Indonesia had nothing to do with the holiday relaxing. It's a brand new version. Despite the appearance of the novel variations, caseloads in Bali have been steadily declining for a few weeks. Over the previous 3 weeks, there has been a 31% spike in cases across Indonesia, according to statistics. Indonesia is the world's 4th most populated country, with more than 17,000 islands. Looking at COVID-19 data in a national context is crucial, but it isn't necessarily the most useful context. When data for each island or province is examined, a more accurate picture of what is occurring emerges. As a result, authorities and communities will be able to make informed decisions regarding the next actions to take in order to keep transmission rates low. Before health officials can consider an outbreak under control, the World Health Organization has 2 criterion points that must be met. The positivity rate is the percentage of persons who test positive out of the total number of people who have been tested. The second factor is transmission speed. Both of these conditions are satisfied for both Bali as a province and Indonesia as a country. Despite the discovery of these novel subvariants, COVID-19 is still under clinical control in Bali. As a result, Health Minister Sadikin was able to assure the public that this recent announcement was not cause for concern. He encouraged everyone to be vaccinated. The booster vaccination is now the most critical part, he stated, the 3rd dose of vaccine /. If you're in a busy environment, try to keep your mask on. Bali was upgraded to PPKM Level 1 this week by the national government. The retail industry may now function at full capacity thanks to this limitation. Cafes, restaurants, event venues, houses of worship, gyms, and tourist attractions may only be able to function at 75% of their full capacity. Masks must be worn in public places inside and on public transportation. The head of the Bali COVID-19 task force spoke to the island earlier this week, urging residents not to become complacent as caseloads continue to decrease. He urged people to continue cleaning their surfaces and receive their booster immunizations. At the moment, Bali is continuing to go in the correct path. Authorities believe that this is a key time and that working together will assist to keep transmission rates low.